So everybody, this is Hamish Brown. He's the director of the Way of Water Chinese Herbs and Acupuncture in Armidale, New South Wales, in Australia. He is a fellow at ICEAM and a Chinese medicine practitioner, physician, clinician, formulacist, and an old friend of mine. And I couldn't recommend him as a practitioner highly than anyone that I know. So it's a real honor to have him here today to talk about one of his favorite formulas to use. So Hamish, why did you choose this formula? What is this formula, and why did you choose it?
G'day Simon, g'day everyone. My favorite formula is by far Gui Si Ni Tang. It's the formula I use the most in clinic, and I've loved seeing the different results with it over the years. The really good results. One of the most incredible skin change and skin improvement with eczema that I've ever seen was with this formula, and it was actually on myself because I used to have eczema. It was one of the things that led to me being interested in Chinese medicine. And during the period where you and I were very much investigating Han dosing and what the dosing was, back in the Han Dynasty,
that old chestnut.
Which I think we should definitely raise up today. Got a note.
It might come up in conversation every now and again.
Yeah, it could just pop up. Yeah. So, I was using a formula called Banqiao Sheshin Tang, which was helping clearing out some of the redness and the heat. And then what I used was a very strong dose of Gui Si Ni Tang, which we can dive into later. And and this is raw, by the way. This is decoction, or bulk, as they call it in the States and other places. And the next morning, my skin had literally improved 50%. I just couldn't believe it. It was nearly like having superpower healing abilities just for a night. It blew me away. And so that led me as well to thinking more about it with skin conditions and then using it in other directions as well.
So you just showed me a piece of paper earlier with you've been writing notes on this for a number of years. You reckon 5 years at least? I think we did that. That was at least 5 years ago that happened, right?
Oh, when we were talking about the Han dosing, definitely it was more like 7 years ago. But I've started to write an article here that I've got notes from, which was 5 years ago, and didn't quite get to publishing stage. So it's really nice to have this opportunity to talk about the formula and hopefully inspire people to think of it more and to get some really wonderful results in clinic with it.
It's not the first formula you think of when you think of skin conditions. I mean, most of the days nowadays, everyone sort of thinks about got to clear the heat, clear that heat, clear toxicity. I mean, that's the sort of thing that you learn in. I mean, it's what you learn in school mainly. If you do dermatology in school, that's certainly what you learn. There's a majority of the formulas. Yeah.
Yep, it's overdone, this heat clearing approach. We're seeing things through too much of a lens of inflammation and just thinking inflammation equals heat and therefore clear heat. It's a little bit like the overused protocol of even using antibiotics just to kill everything. I mean, if you try and kill everything, yes, you'll kill some bad pathologies, but you'll also disrupt healthy good physiology. So I love how Gui Si Ni Tang can clear inflammation by bringing healthy, abundant blood flow back to areas, and specifically the periphery. So Gui Si Ni Tang is famous for warming the blood and opening up the collaterals, opening up the micro blood circulation, but it's also a blood nourisher. So it's doing a few things at once. And when we get healthy blood flow going back to our tissues, we get all the oxygen, we get all the nutrients, and the tissues can come back to normal. Generally, a lot of inflammation takes place in the body in different ways because there's not healthy blood supply there, whether it be a block of fluids, a blockage of blood, or dryness or deterioration of the tissues. So, yeah, it's something that's often on my mental radar, thinking about where we need to get blood flow improving to.
Mm. And we've discussed this formula between ourselves and with our other colleagues, and we're always giving you grief about prescribing Gui Si Ni Tang all the time,
Yeah.
within our circles. But so I'm interested to hear your opinion about location, because obviously in your area you have it's this Chinese medicine, and all medicine, well, not all medicine, but good medicine, I should say, is circumstantial to the environment to some degree.
Yes.
There's the internal environment,
Yes.
external environment. So what's
Great
your opinion about?
So
So
that's
let us
really
know
important.
what
So
you think.
I live at above 1,000 meter altitude in northeast New South Wales near Armidale, and winter's cold. I've got the heater on, wood fire heater on behind me, so I definitely have the opportunity to utilize this formula more easily than what people would do in a warmer climate. But I still think it's underused in the warmer climate. But because I'm at altitude and we have colder winters, we have colder air, we have more pressure on our peripheral blood circulation, it's easier for me to use this formula more often and in a strong dose and get easier, safer results in one way. Because when you warm someone up, you do have to be prepared for some collateral inflammation stirring up temporarily, or you have to be also prepared if you got your diagnosis incorrect and what's going to happen if you're warming someone's blood that you shouldn't be. So I can get away with that definitely more easily because of our cold climate. However, I also think it's because a lot of people are afraid of warming the blood and warming the body too much. It's often really underutilized in other warmer environments as well.
So do you see it flare up? Do you see people's skin you talk about sort of this temporary flare up as you speak? Like, do you think you use these principles of harmonizing someone first? You have to clear out something first. Like you mentioned before, sort of a Sheshin tongue. Do you need to do that first, or have you found you can just go straight into? I mean, if we're talking specifically about skin conditions here, I'm sure it has other clinical applications. But if we're speaking about skin conditions, this is something that's clearly, it's very obvious for someone to see whether it's working, whether it's not. And so, can you speak to that a little bit?
Definitely.
What's your strategy?
Yep. So normally with skin conditions, I don't see them flare. However, with women that have menstrual cycle issues and acne, then I will often see the skin flare a bit, but it flares in a different way than how they would normally experience it. The skin, the pimples and the acne tends to heal faster, but they may still have a hormonal breakout like before, or maybe sometimes it's already improved on the first cycle, but sometimes it will take until the second cycle before it settles down. So that's with acne, and usually it will improve quite well. It's just slow because when you're dealing with the blood level, it's not something you can just go, okay, there's your blood. It's not like a blood transfusion. It takes time for it to build up. With eczema and psoriasis, dermatitis, for example, I don't usually see the flare up that much, and that's if the treatment is appropriate. So in other words, that goes back to your other point. Does the person need harmonizing, as what the term that we use to regulate Xiao Yang in ICEAM? Do they need that first? Do they need a little bit of decongesting of Xiao Yang, of Sanzhou and gallbladder? So if and the way that we then know that in our system, if that's appropriate to do, is via the pulse. So if the pulse is, you know, more like a Sheshin pulse or a Chai Hu, you know, formula pulse, then yes, I would use that first. There is a few little examples where I would often jump straight to Gui Si Ni Tang, but I wouldn't advise that if you haven't had a lot more practice with it. I would advise a lot of people, if they're not sure and they want to get into warming, but they don't want to, you know, cause any side effects, I would say, yeah, do a couple of weeks on a Sheshin Tang formula or a Chai Hu formula. Interestingly, I find that the Sheshin Tang is probably more appropriate to then going to a Gui Si Ni Tang than a Chai Hu formula, but that just depends. Like that's just my own experience, because often I'll look for a hollow left guan with the prescribing of Gui Si Ni Tang, where the more standard pulse that we would think about is like a deep, thin, wiry, expiring left guan. Now, if that's there straight up, when the person comes in the clinic and they've got that nice, deep, thin, wiry guan, and if it's expiring, then even more you can be confident just going straight to the formula. But say both of the, you know, middle positions are high, and we think, oh, it might be a Sheshin Tang, but there's quite a lot of hollowness on that left guan. I won't stay too long on a Sheshin Tang if I do use it first. And if there's very clear hollowness on that guan, but it still could be a Sheshin Tang. If there's no Shaoyang flaring symptoms, if there's no heat symptoms, and it's really a very cold picture that's clinically being presented, I would also then go straight to Gui Si Ni Tang. So the differentiation is really important. You know, from line 351, if there is a reversal cold of the hands and feet and the pulse is fine and verging on expiry, Gui Si Ni Tang governs. So even in the Shenghan Lun, we have that reference point for the pulse. And then with ICEM, you know, it's in our understanding of that is broadened and increased with the other pulse characteristics we use.
And I imagine, you know, that takes, you know, years of calibration as well to pick those correct pulses as well. It's a clinical calibration of those things through the practice. Yeah.
Yeah, that's right. As you know, I'm really grateful for ICEM and the clinical training that we've received, where we can slowly refine our pulse taking skills and then also our differentiation, because it helps us aim so much better for our you know, when we're shooting that bow, that arrow in clinic for the diagnosis. Gee, it's so much more likely to hit the nail on the head and to hit that bullseye if we have that that calibration, differentiation ideas in
for
our
sure,
head.
for sure. And so with the you mentioned acne. Have you had any? I mean, my experience with it and clinically, that's just my experience. You know, I've tried it a few times. I've had some success.
So
I had one or my experience using Gui Si Ni Tang, depending, you know, modified or not, with psoriasis. You know, we're still talking about skin conditions here, and I've seen it used in clinic, but I've never been able to hit it. I've got it once or twice, but the other times, you know, it hasn't. I mean, psoriasis is not exactly an easy condition to treat at the best of time. But have you had experience with that?
More eczema.
More eczema.
Again,
Okay.
yeah, more eczema. So often with psoriasis, like full blown psoriasis, I'll be using like a different formula to start with.
Okay.
Yeah.
Okay. Yeah.
Like yeah, some ones that I yeah, too complicated then.
It's okay. for another time. Yeah. When we speak about psoriasis, yeah.
Yeah.
And what about other clinical applications that you found apart from skin? What else have you found it useful for?
Yeah, so what I thought I might do is just rattle through a few symptoms
Mm,
that I look for and that I would encourage other people to look for. And a lot of those symptoms are just blood deficiency symptoms.
okay.
But I'd like to explain a bit more how those symptoms are treated. Pulse, we've just talked about. We're really looking for a blood deficiency type of pulse, and we're really looking for um, that, particularly on the liver position.
Hmm.
We could go into more depth, but let's just leave the pulse probably via that.
Hmm.
This is going out to a wider audience, so want to respect the pulse lineage material there. Now, if we go to the next thing, tongue. So I only look at uh, the tongue on the first consult in general, unless I see something really significant that I'll follow up with. So the first thing I'll look for, which you see quite a lot, is a pale tongue.
Mm,
And a pale tongue is very simply blood deficiency. There's really not not anything else that should jump to your mind. If you see big, deep cracks, you know that fluids and probably blood have been really injured at one time. Um, so the next thing as well is if you see that little bit of purple in the center or purple through the sides, you know that there's not only just blood deficiency, but the blood is getting cold. If you
yep.
then see any purple spots, you know that the blood is not only getting deficient cold, but it's also getting stagnant.
Hmm.
And then I look at the sublingual veins. So yeah, it's very easy as well to note the blood deficiency there because you'll see really thin sublingual veins. Or they'll just be so pale and they blend into the other geography of the tongue. Or they'll be quite short.
Right.
Or they'll be really thin but twin branched. You might, if there's more stagnation, you'll see the purple dots around, especially around the side of the frenulum of the tongue, and branching up. And often the color won't be a nice blue; it'll be like more purple, so to speak. So again, you more signs of stagnation. So I usually have a bit of a look at that just to confirm what I might have felt in the pulse, or to see if there's other signs there.
Okay.
Um, Now let's talk about the the other symptoms. So, for example, with blood deficiency, obviously one of the first things you should pop to mind as well is a pale complexion. If someone looks really quite deathly and cold and pale, that's a very clear symptom that we would look for. Now, one of the next things is dry skin. Now, why is the skin dry? Very simply, because it doesn't have enough blood going to it. So,
Mm,
Gui Si Ni Tang improves blood to the most peripheral tissue, which is the skin, and the peripheral parts of the body, the head, hands, and feet. And we shouldn't forget the genitals as well. Gui Si Ni Tang promotes blood flow there pretty well too. Okay. Um, when I look through my initial consultation form, and if anyone wants to have a look at that on my site, feel free on the Way of Water. You'll see quite a list of symptoms people tick through. I always try to collect, and this is more my way of consulting rather than the typical ICM. For the first consult, I like to collect a big broad amount of information and then focus in afterwards. So as much as that can be confusing for some people, I've found it very helpful for me over the years to refine my diagnostic skills and support what I'm feeling in the pulse and seeing in the tongue. So,
mm,
low blood pressure. That's another one that really comes along with blood deficiency. And I don't think I need to explain more the physiology of that and the connection to obviously anemia. Now, if I also see chest pain and palpitations, I'll be wondering, okay, is the heart blood deficient? If
mm,
I see symptoms such as varicose veins and easily, being bruised and bleeding quite easily, I'll again think about What is the quality of the blood circulation? Is the periphery cold? Is there enough blood, or is it stagnant, or are all those things combining together? And we can talk later about how I would modify Gui Si Ni Tang if there's more blood stasis, or if there's maybe a little bit of some heat signs or more cold signs, etc. We can go into
Mm.
that. Now, muscle cramps is a really interesting one that is treated so well with Gui Si Ni Tang, and this is this is interesting because sometimes you'll do a Xiao Jianzhong Tang formula or Huangqi Jianzhong Tang or something that has a double dose of Baishao, but you won't get the change in the cramps. The cramps won't reduce. And then you use something like Gui Si Ni Tang and it changes. So it wasn't only about nourishing blood, it was also that the blood needed warming and collaterals needed opening up. Interestingly, though, and this has happened so many times now that it's just part of the course. I just even say to people, be aware that your cramps may get worse the first week or two.
Okay.
There's this interesting process that as the blood flow is returning to tissues, you can stir up some old inflammation, or the symptom can stir up before it then resolves.
Right.
So I've definitely seen that happening with cramps quite a bit. So as soon as it gets worse, I said, don't worry, next week or two it'll get better.
Okay. Mm.
But really good mental note for people. It doesn't mean you're on the wrong track. So headaches. Oh, I mean, here's another really, really important clinical condition, because it is definitely my favorite formula for treating migraines and headaches. There's so many different mechanisms, but I would sum up headaches and migraines as dysregulation of blood flow in the brain or in the head.
Yeah.
So what kicks that off can be heaps of things. It can be midnight on the alcohol. It can be food.
Neck
it
problem.
can be this.
Spinal problem. Yeah, everything. Menstrual issues. Yeah.
Yes.
Menstrual irregularity.
Right. There's so many things that can kick it off. And you can sometimes chase those symptoms by thinking, oh, we need to work on this particular one and this particular one. If the symptom picture fits and the pulse and the tongue as well, for example, I would be straight away wanting to regulate their peripheral blood flow. Gui Si Ni Tang is amazing for migraines and headaches. It's fantastic.
Mm.
Now, I actually want to jump in and mention something just before as well, that's quite important with Gui Si Ni Tang, because some of you might be going, oh, we can't use Gui Si Ni Tang, we can't use Gui Si Ni Tang, it's got Xixin, it's got Mutong in it. Now, with Gui Si Ni Tang, I do not make it up as individual ingredients. I use a patent formula that's been shown to not have AA traces in it. So that's how I would also recommend if people were to use it. You've got to know your supplier, you've got to know your quality, and they've got to be able to give you some confidence with that. So I hope that answers that in a general sense. We can talk more about the ingredients of the formula a little bit after though as well.
Yeah, let's do that. Let's go through all the ingredients as well at the end.
Definitely, yeah. So headaches, migraines, yes. You should see the intensity of the migraines reduce. You should see the frequency of them reduce. So just give it time. And you may need to use a Chaihu formula after a few months if there's a bit of a Shaoyang flare, or if their blood's, because as the blood builds up, your body's going to be able to do some homework that it hasn't been able to do for a while. It's going to be able to shift out some old inflammation that it wasn't able to do. So sometimes that might be a bacterial load or a viral load.
And just when you mentioned Chaihu formulas, you've talked a couple of times about Chaihu formulas. So can you just give a couple of examples, you sort of top 2 or 3 that you would go to ones?
Yeah.
Just for people who aren't familiar with your system.
Sure. Yeah. So Chaihu Guijitang, I would often go, because Gui Si Ni Tang is a Guijitang base formula.
Mm.
So I like to use Chaihu Guijitang as generally the formula that I would switch to. Perfect. Usually I don't find Chaihu Guijiganjang Tang necessary. Sometimes just a Xiao Chaihu Tang. If they've got sleep issues that have suddenly stirred up, I might do a chai hu jia longu muli tongue.
Mm. It's interesting you say that the first one is Chai Hu Tongue. I totally agree. I saw it really super effective with that sort of Gui Si Ni Tang present. I mean, I think you prescribed it to one of my patients one time, and she was having these recurrent menstrual headaches, and the harmonizing formula was Chai Hu Tongue with plus Gurgen, which just worked amazingly, and then back onto the Gui Si Ni Tang. Yeah, I mean, from clinical, I've seen it just so effective. So that's it's good to see that's your first go-to.
Yeah,
as opposed to Chai Hu Kanchang Tong.
Yeah. Cheers. So if we're just finishing off with headaches and migraines, people should think about obviously shishin, how important it is with headaches and migraines as well, because of its ability to warm and open the collaterals, and it warms the lungs. So yeah, it's been great having Arnold describe more how when we warm the lungs, we are going to warm the blood. There's all of
Arno
the
Veslus you're referring to.
Arnold,
Arno
yeah.
Veslus, yeah.
Arnold Veslus, yes, that's right, yeah.
Just for people who don't know him, yeah.
Yes, Arnold Veslus, yeah. I should add that on. So how shishin warms the blood, moistens the blood, warms the lungs, because one of the direct ways into the blood is through the lungs as well. Well, direct as in one of the most direct ways, probably is important to say. So respiratory wise, you might have someone with eczema, but they have a bit of a tendency to have some asthma or cough or something like that, and often Gui Si Ni Tang is going to help that as well because of its lung warming function. So neurologically, that's the next set of symptoms that I would be thinking about. Now, Gui Si Ni Tang is a Jue Yin formula, so it nourishes the blood of the liver, the pericardium, and we're taught that very much has a connection with the nerves. If you want to nourish the nerves, you need to nourish Jue Yin. So nourishing Jue Yin, I think, is becoming more and more important in this day and age because there's more and more blood deficiency and more neurological conditions. So Alzheimer's, dementia, Parkinson's, all of these neurological conditions have some of that brain dysfunction and the deterioration of the nerves. And the blood nourishes the nerves. So if we think definitely of Gui Si Ni Tang when you're treating any neurological issues, differentiate if it could be the formula that could be the right one. So dizziness, that's something I also often treat with Gui Si Ni Tang. Yeah, very effective formula. Of course, if it's more of a fluid metabolism issue, we may need to use something else like Wuling San or Zhe Tang, etc. But often dizziness can be helped as well. So another one is loss of balance. Again, just improving blood flow to the brain. You can see an improvement in balance. Muscle weakness. I've seen people feel stronger with their muscles just from having more blood flow and more blood going. Yep, that's it. Now, one of the other main symptoms is numbness. So numbness is a lack of Shen and blood going to a tissue. So as soon as you get blood going back to the tissues, you get the awareness, the Shen, and the area comes back to life. So numbness and tingling. Like whenever I have a woman that comes in who's got all these, she might have some blood deficient sign and she's got numbness and tingling, especially if she wakes up at night and feels it, or wakes up in the morning and her arms, hands tingling. Gui Si Ni Tang is incredible for that. Like it's sometimes boring treating it because it's so easy. It's just so
good problem to have for sure.
Yeah, it's a good problem to have. Exactly. Like that brings me as well to chilblains and Raynaud's. So if there was one clinical trial, if there's any researchers that listen to this and you want to have a really successful clinical trial, my go-to trial would be using Gui Si Ni Tang for Raynaud's.
Yeah.
So awesome. Raynaud's is, condition of cold blood, basically, but they've got chilblains. They often have such extreme cold hands and feet that they not only get numb, but they can get purple, they can get white, they have spots on them, and they can even have like sweating with the cold hands and feet. It's a really awful, uncomfortable condition, and I would say 8 or even 9 out of 10 patients that have Raynaud's are all Gui Si Ni Tang patients. There's not that many other formula strategies that we would use for it. Interestingly, I've treated a patient with Raynaud's with Bansha Sheshintang. But as I said, often I'll go from Bansha Sheshintang to Gui Si Ni Tang. But yeah, Gui Si Ni Tang. If you get a patient with Raynaud's or cold hands and feet, and especially if it's quite extreme, enjoy seeing the very powerful results that you'll get with Gui Si Ni Tang with that. It's just so effective.
Always love to hear from people who try these things and it doesn't work. You love that you said 8 or 9 cases. I love those 1 cases. Like when you find something this successful, it's just ridiculous that there are people just going around just don't even know about these formulas, and it's just such a pity. So to be that effective, it's just incredible.
Yeah. So it's just such a high response rate. It really is. Seizures, epilepsy, memory loss, all of those things can also sometimes be appropriate to be treated with Gui Si Ni Tang. Even insomnia can slowly resolve with it when you're building someone's blood up. But that could even bring us to the dosage, which we'll talk about soon, which is especially the dosage of Dazao or Hong Tao, because the second highest formula dosage in the Shanghanlong and Jingwei of Dazao is Gui Si Ni Tang. The only one that's bigger than that is Zhegan Sao Tang with 30 pieces. So Gui Si Ni Tang has 25 split or broken pieces of Dazao compared to the average formula, which has 12. So it's just over double. That says a lot about how important Dazao is for tonifying the heart. Now, this also, I think we need to explain that Dazao in the Han Dynasty was closer to what we think of as Hong Tao today. So I would not suggest using the big, beautiful black Dazao pieces for your Hong Tao. I would use the nice, big red pieces. I know some people also like the really small, there's a nickname for them, like the rooster size, like, the small Hong Tao. I think that they're okay, but I would use the bigger Hong Tao. And I've seen a fantastic product from Spring Wind in bulk, in raw available, where you've got dried, sliced pieces of the whole fruit with the seed. I think that is fantastic, because then you're not getting a hollow Hong Tao, you're getting the action, you're getting some constituents coming from the seed, but you're also getting it split, because if you have a whole Hong Tao, it's got that permeable skin, it's got that skin on it, which needs to be more permeable. You need to break it open. So I think the dried product that is available there from Spring Wind is perfect.
Yeah, I think the Dazao, when it's so funny that Zhang Yunjing said broken. I mean, it must have been that, like the word broken. I mean, who knows about the semantics of the translation? But I should not say who knows. I don't know the semantics of the translation, but I'm sure there are people out there that do. But the word broken, we've got this English word broken. I assume that's what it means. Like when you grab it and you kind of twist it. We used to give it when we give it to patients before the sliced pieces there was a full piece, and that method of just kind of twisting it was really good. But I used to found that if you twist it, we were twisting it and then throwing it in the thing when we're making up at clinic, because if the patient was doing it, sometimes they would forget. You could ask them to do it, but then have to pick through the formula. We used to just like leave it unbroken, and then as we're putting in the formula, because we know, look, we're going to cook it in the next few days' time.
Used to do the exact same thing.
Twist it, and throw them in the formula, and away they go. So yeah, it's a good little strategy. So, do you want to go through the herbs so we can talk about a little bit about them together, and then about the dosage?
Yeah,
just for time.
Let me just cover a few.
You want to finish anything up? You want to finish off? Yeah, please. Yeah.
Yeah. So with sweating, I've seen sweating reduce with Gui Si Ni Tang, but this is not the common thing. More commonly, Gui Si Ni Tang people will have a hard time sweating. That's also, in general, a characteristic you could look for. You could say, "Oh, do you sweat much?" Would you say you sweat as normal? And the person answers, "Oh, hardly at all. No, my friends are really sweating, and I hardly sweat." So that's another sign of blood deficiency. There's not enough blood to be able to sweat the fluids from the blood. The body conserves it. However, there are some circumstances where the sweating is due to the dysregulation of the blood flow in the periphery in the skin, and I've seen Gui Si Ni Tang help with that. So that's one interesting mechanism, and also hot flushes. Hot flushes I've seen reduce as well, which is surprising. Swollen glands brings me to one of the modifications of Gui Si Ni Tang, which is Gui Si Ni Tang and Huang Qi. I can credit, Laurie Ayres with inspiring me with that particularly. And I saw my glands in my throat reduce down a bit when I was doing that. So again, getting the fluid movement in the collaterals, think of the lymph system as part of that sanjiao, the fluids moving. So itching, I usually think, first off, as soon as someone says the itching, I think, okay, where is the blood not getting to? Where is it? Are they itchy on the back? So how do we, is it just improve the peripheral blood circulation? And gynecology, really important to talk about that, because women's menstrual cycles are not as harmonious and balanced as what they should be. The new normal these days is to have period pain, where it should be abnormal to have that if everyone was a lot more healthy. So period pain, also heavy bleeding. This is the really interesting thing of using Gui Si Ni Tang and other formulas like Gui Ji One, where you promote the blood flow to the liver and the reproductive system, because the liver channels go through the reproductive system. You'll be able to reduce bleeding by promoting healthy blood flow to the area. Yeah, and especially ovarian cysts, endometriosis, those type of conditions, we need to get better blood flow to the reproductive system. So I usually don't use phlegm transforming herbs like a lot of people do. I focus more on building the blood and moving the blood, and then sometimes more aggressively promoting blood flow, which, let's just briefly tap into a couple of the combinations. So one of the probably the most common formula combination I give is Gui Si Ni Tang plus Gui Ji One. That is just, in my opinion, the best gynecological formula. I love Wenjing Tang. It's absolutely fantastic, but I feel like I can use Gui Si Ni Tang and Gui Ji One more. And it's sometimes harder to have someone that fits the bill for Wenjing Tang. I find it easier to fit the bill with Gui Si Ni Tang and Gui Ji One. So, and the cool thing about Gui Ji One, for people that might be a little bit hesitant on using or warming their patient's blood, Gui Ji One has got Mudan Pi in it, which has that a little bit of the cooling blood function. So it's like putting a little bit of checks and balances in there. So that's one of the ways that I've found that I don't need to go back and harmonize as much if I have Gui Ji One combined with my Gui Si Ni Tang, for example. Now, say if the person has cold blood deficiency, and more blood stasis, but they're really on the cold side, and I don't want to use Gui Si Ni Tang, then I'll use Dr. Zheng's idea of just adding Taoren and Honghua to Gui Si Ni Tang, and I found that fantastic. It's I've had some young women especially that have had that formula, and if I take out the Taoren and Honghua, they just have not felt as good. So they need that extra blood moving help with Taoren and Honghua. Now, let's say if it's much more heavy blood stasis, so an older woman potentially that's got ovarian cysts or endometriosis, and they're having really strong clots coming through, big clots coming through in their menstrual blood, and it's very painful. Then I would add in the strongest class of the blood-moving herbs, which is like the animal products like shuizhi and dibiechong, and we really break down those malformed and basically mutated tissues. We need to get the blood flow restoring to those tissues to get them back to normal. And the results again with that are very, very strong. And I would recommend at are they using those strong blood moving herbs enough? If there's those signs with the cycle, if they've got clots and heavy pain, and you just give something a little bit more general and it's not coming through, the results aren't coming through, take it up a notch and really add those in. So that's also pain with intercourse. I found Gui Si Ni Tang and Gui Si Ni Tang for patients really helpful that have mentioned that they have pain with intercourse. Again, you're getting the tissues there more robust because you're improving the blood flow there. Breast tenderness, breast lumps. Again, reproductive system needing more blood flow. Often I treat that with Gui Si Ni Tang. Now, with we shouldn't forget the men here. So for men, Gui Si Ni Tang can be great to help them with erection problems, especially if they notice some cold in the genitals, and if they have any swelling or pain of the testes, then you can add Gui Si Ni Tang as well onto that formula and use the same sort of principle that we just talked about before. Mentally, emotionally, there'll be people that are on the irritable, frustrated, angry side that you give a chai hu formula to them and it won't calm them down. And in my opinion, that's because generally their liver is calling and screaming out for nourishment and blood support rather than just decongesting. So don't always think of anger and irritability and frustration as an excess sign. It can be a deficient sign, in my opinion. And you just need to give that liver a bit of TLC with, Dongui, Baishao. And yeah, it's amazing how the person can just feel like they don't have the same pressure and tension in their life. And you think about the function of the liver, it's, regulating the moods in Chinese medicine theory, and they're very much connected to the potential frustration. So it just helps to open that up. As you're nourishing the liver and opening up the blood flow of the liver, the person mentally, emotionally as well can feel that difference. And then the last thing I would mention is with the eyes. So the liver connects through to the eyes, and the liver blood nourishes the eyes. So if you have someone that's tending to get floaters or blurry vision or really struggling to see at night, and another eye conditions as well, that can often be a sign that there's poor blood flow going to the liver and therefore the eyes. All right.
I totally could agree. It looks like clinically with all these applications, it's incredible how one formula can have such insane clinical scope. Sometimes you can see all the principles in some of other formulas, but it really does sum up a lot of things. So it's pretty awesome. So with the herbs in the formula, obviously. Just go quickly through them. So in the Shanhan Lun, it was Dongwei, Xiaoyao, Zhigansao, Tongsao, Guizhi Xin Datsao. So
someone said Tongsao. Yeah, we've got to talk about that.
Yeah, let's talk about that. So obviously we talked a little bit about Dungwei and Xiao Yao. Obviously, in the Han Dynasty was not obviously, but according to some people, I don't know. There's a couple of people out there that think that. But yeah, I mean, in this formula, big, the sourness of it. But so that's by Xiao Yao, and then Zhegan Sao. Obviously, we could go into that, but that's probably for another time. So
Well,
Gui Zhe,
yep.
Gui Zhe says to remove the bark, and
Yep.
let's not bore people with that. They can always go and watch me doing a 3-part YouTube documentary about that.
Exactly. Yep.
And so Darth Sao, we spoke a little bit about earlier about the broken aspect of it. So there's just 2 left. So Tong Sao and Xixin. So you mentioned before about AA, aristolochic acid. So Tong Sao, I mean, I know the history, but why don't you tell people the little bit of the history about Tong Sao?
Sure.
So why is it called Tong Sao? So please.
Well, no, I won't talk about why it's called Tong Sao, but I'll talk about why it can't be Tong Sao.
Okay.
So with Han dosing, in the Han Dynasty, 1 liang equals 15 grams. Now, if anyone hasn't been able to reach that conclusion themselves, please just look up the standardized weights and measurements of the Chinese Republic and history. It's so clearly stated that 1 liang equaled 15 grams that it's
15.625. Just
there we go. Yeah, that's right. It's been very frustrating that Chinese medicine as a profession, as a field, hasn't really focused in on that enough to see all the gleams of jewels of information that come through looking through the lens of a different dose. So Dungwei was at 3 liang, so it was 45 grams. Guizhi 45 grams. Baishao 45 grams. Now those 3 herbs together are really important because of the synergy that takes place in the liver. So Dungwei is giving that bitter and fragrant blood nourishment to Jue Yin. Guizhi's more stirring the healthy wood, fanning wind, fire, and Baishao is giving that softer, astringent, blood nourishing effect to the liver. So you really getting a combination of effects on the liver. There's a really important synergy that happens with Gui Si Ni Tang. It's also one of the reasons why I like to generally use it as a patent, because you'll get a different synergy having the formula decocted and cooked than you will just adding the single ingredients. So with Tong Sao and Mu Tong, so when you go from 1 liang equals 15 grams, if you and for the Mu Tong, the dose is 2 liang, so which is 30 grams of, say, Mu Tong or Tong Sao. If you did 30 grams of Tong Sao, you might need 3 pots instead of 1. It is not possible to fit it in. I remember when I was first doing this and weighing out the Tong Sao, because Tong Sao is so light and fluffy, there's no way that you're going to fit 30 grams of Tong Sao in your general pot. It so obviously is incorrect with
and the
when
dose
you
is. Yeah, sorry to interrupt, but yeah, the volume of water, right, is
exactly
1600 mils. Like, how are you going to fit that in? It's impossible. It soak it all up in 2 seconds.
It's I think it's 1.2 sheng, or is it more than that?
8,
anyway.
isn't it? 8 sheng. Yeah,
8 sheng.
1.6.
So 1.6 liters. There's no way that Tong Sao could fit in that much water. And you'll notice that with every single decoction that is in a Shanghan and Jingwei, when you actually weigh it out and do it, traditionally with how much water it's suggested, it's always perfect. It's always perfect. So yeah, the Tong Sao, it can't be Tong Sao, it's Mu Tong. And also I think Mu Tong is important because it clears the heat more strongly than Tong Sao. So it's one of the checks and balances of Gui Si Ni Tang. Just another couple of quick things to mention is with blood deficiency. So blood deficiency is something that is happening more and more these days because of multiple factors. People might have bleeding noses that go on for years. They might have physical trauma where they lost a lot of blood. They might have menstrual bleeding, heavy menstrual bleeding for such a long time. They might be donating blood all the time. They might be losing blood with childbirth. And also there's more and more vegetarianism and veganism that's also leading towards blood deficiency as a very common result. So think about blood deficiency, have it on your radar. Now, one of the ways that I also think of blood deficiency to incorporate is gelatin. So that's something we've talked about, nourishing the blood, nourishing the gut lining, helping people to build their nutrition back up. So if you don't have a good, healthy gut lining, you're going to find it harder to build your nutrition, which is also why sometimes we need to focus on fixing the gut issues first before we can build up blood. A low temperature threshold is both ways is another important sign of blood deficiency, and something we've done with Gui Si Ni Tang is when someone has trouble handling the heat, but they also can't tolerate the cold. That's reflecting that weakness. Interestingly, the Chinese military used to use Gui Si Ni Tang if they went to alpine regions, for example, towards Tibet, to prevent frostbite.
Wow.
And on closing soon, I just wanted to mention, and this is not coming from Simon at all. This is purely coming from me. If you're not aware of the extraordinary lengths that Simon and Spring Wind go to get the highest quality herbs in the world, then please do your job as a practitioner and find out what they are doing, because it is a cut above the rest. I have a background with organic medicinal herb farms with my family. I've been passionate about quality of Chinese herbs. Simon has gone a direction that I would have been interested in going myself, but he's taken it to another whole level. So we are so fortunate to have access to not only good products, but the best products in the world with what he's doing and what he's getting in. So don't compromise on quality, guys. Get the best stuff. And if you need to charge more for it, don't compromise. But a lot of the products are just absolutely fantastic. So make sure you see what he's doing if you haven't already.
Thanks, mate. We appreciate it. And you've been our you're probably the first the first customer I ever have. I think when we made Wumei one the first time. It's so interesting because today we weren't supposed to turn this into a plug for the business, but obviously we've got to separate out education, but with with herbs. But you were the first person to buy Wumei one from us, and not finding out that it was that it was possible to be made, it was pretty cool. So I mean, you've been around for a long time. So I think without your kind of support, we wouldn't be doing anything. So because it takes skill of practitioner to be able to be skillful enough to understand these formulas and use them. So hats off to you too, my friend. And so all right, so we could probably talk more about Gui Si Ni Tang. I mean, I could see a lot more possibilities in terms of talking about cooking the formulas, the other applications, the difference between granulation, single, bulk herbs, all sorts of stuff. We didn't touch on too much on the other details about the different species of mutong, tong sao, how tong sao used to be mutong, mutong's tong sao, etc., and all the different species that are associated with mutong. We didn't really get too much into the water extraction and how aristolochic acid isn't water soluble for shishin, hence why it's used as a decoction. to neutralize that. The legalities around that as well that are happening in different, certainly in Australia, and I know in the US they have the same regulations, and how doing it the correct way and with the correct herbs actually makes all the difference, and rather than a misunderstanding of the base formulas. But if people are interested, they can get in contact with you. So we'll put your email at the bottom if they want to shoot you emails and ask you more questions about Gui Si Ni Tang. I'm sure you're always keen to help out students and practitioners alike.
Definitely.
But look, thanks so much for your time today, Hamish, and look forward to talking about it with you more. So we'll get you on another time. Pick another formula that you love. I'm sure you've got a whole
Oh yeah, we're going to talk about
a whole dispensary full of it. Yeah, totally. All right, my friend. Well, until then.
Yeah. About the shortage of it in the market at the moment, actually.
No, let's not.
So thanks, buddy. Thanks for having me on, and I hope everyone got lots of good info from that. And shoot me a line if you need.
Hey, thanks so much again, Hamish. Talk to you soon.
Cheers.